All right, can everybody hear me okay? Good evening, everyone. By my timepiece, it's 5:30 p.m. And at this time, we'll call the EMS Medical Services Cost Review Board to order. And our first item on the business is to call the roll. And pardon me, Dr. Dabbs, but it's ladies first here. So, Ms. Livers,
Present.
Ms. Durrett,
Here. Dr.
Dabbs. Here. And Rick Valentine is present. Director Phillips is absent. But with his absence, even we'll determine that there is a quorum. And I would just ask that everybody keep Director Phillips and his family in your prayers. His mother passed away suddenly over the weekend, and their services are going on this evening as well. So keep those folks in your thoughts. All right. The next item is to set the agenda. I have one item that I would like to pose to the committee, and that is just between items 6 and 7 that we insert a public comment period there, just to say that we've had a public forum on this matter prior to us taking up any action. Is there any objection from the committee members? All right, is there any other agenda items or any changes to the agenda any committee member would like to make? Seeing or hearing none, we'll move forward in the agenda. With the approval of the minutes, I know they were disseminated electronically to us. There is a copy there in your packet. Please take a moment to review and accept any changes or corrections or additions to the minutes, or entertain a motion to approve as they've been presented.
Only correction is my name has one L. It doesn't really matter to me, but so that there's not somebody else that accused that I wasn't here. So other than that, move that the minutes be approved.
Second.
So we have a motion to approve as corrected and a second. Any further discussion on the minutes? All in favor say aye.
Aye.
Any opposed likewise? And the corrected minutes have been approved. Next item is a review of the AMR proposal. I know that we had some additional information also that has been provided by the Department of Health, and I would like to say thank you to those members of the health department there that were able to get this together for us and ahead of time for us to review. And committee members, we will open the floor for any questions. I think we should maybe allow AMR at some point here to see if they have any additional items or any information that they'd like to provide us. But is there any questions amongst the committee members there as we review the proposal?
I just have a question from AMR in terms of, if y'all, can you guys hear me okay? So I can speak loud, real loud. And that is, and we may have established this last time, but in terms of the proposed rates, was there a method in terms of creating the proposed rates based upon something, or obviously the allowable or the collections and kind of a target that you guys were trying to reach? So I'm sure it wasn't a haphazard. Y'all have kind of kept these rates, and we have discussed again how low the rates have been for so long, and understand the need to keep them current for various reasons. But I wasn't sure exactly how you guys came up with the rates and trying to compare those with the rates that we received, in the last week or so.
Yeah, and I'm sorry. Really, our rationale was just to try to get the averages of every surrounding counties, all those that we could obtain, and that's what we did. I know last meeting, Director Phillips asked for if the average had included or excluded the top and the bottoms to kind of even it out, and that's in your packet as well. We did it. We took a look at that and added to the packet. So, and that's the only real rationale behind it. And I think, to echo Mr. Valentine's comments, I appreciate the due diligence to receive the information from other kind of municipal services and counties across the state as similar comps, and those looked pretty, about pretty accurate to what we're seeing in other areas.
Committee members, any further questions for Mr. Spencer?
Mr. Spencer, do you have anything else you would like to add? I know we kind of came at you with questions last time. Is there anything that we feel like we need to know that might not be in this information that's in front of us now?
No, ma'am. The only comment I would add, I think is the same thing I mentioned at the last meeting was, these are obviously long overdue. We haven't asked for a rate increase that I'm aware of ever since 2013. And certainly the cost of every business is certainly increasing. And I think this puts us more within reason in our line of business. The only other comment, which is also in your packet, was when I reviewed, how much this was over Medicare allowable and looking at our payer mixes for the last 3 years. These usual and customary rates only affect about 30% of the population of Knox County, because those are the ones that don't have a fixed schedule based on their Medicare or Medicaid for ambulance transport. So it's not going to affect the entire population, only about 30% or so that have commercial insurance or no insurance.
And I would assume that transporting a Medicare patient with these usual and customary rates, y'all probably lose money on every Medicare transport that you do. Is that correct?
It really depends on the mileage, how far we transport them, but it's barely breaking even on a Medicare transport right now.
I think we asked last time, and I couldn't remember exactly what you said, but is there a projection on your amount of revenue you may gain with these new rates?
We did take a look at that, and the total revenue increase was about a little over $1 million annualized, which again, quite honestly, it just tries to get us a little bit further out of the current red that we're in. We're already in the red, and that doesn't even make us whole.
Committee members, any further questions for Mr. Spencer?
No, it appears to me that the proposed rates, from the information that we have, seem to be certainly consistent with the rates in the area and the rates in the state of other like-size facilities. I noticed that you can't really use the Davidson County rates. They're kind of a bizarre not a bizarre system, but you really can't compare what they're doing, because obviously somebody's subsidizing Davidson County EMS some way.
Yeah, Nashville Fire operating that. They were keeping it there just strictly because of probably their subsidy and everything.
Yeah.
I would agree.
And I
Go ahead.
see, I'm trying to look at
All right, is there any other comments or questions related to the review of AMR's proposal before we move into our public comment period? Okay, seeing or hearing none, we'll open up the floor for a public comment period at this point in time. If there's anybody in the audience or anybody that would like to make a comment regarding this proposal, we'd certainly invite you to come to the podium, state your name and your address, and you'd have 3 minutes to speak. Seeing no rush to the podium, we will proceed and open the floor for any action from the committee.
Yeah, I have another question maybe for you, Mr. Hamby, in terms of just the adherence of AMR to the kind of the standards, you know, again, that we set in terms of, you know, their the kind of requirements of the contract in terms of timeliness and response and all that kind of stuff. And because of various reasons, you know, in the past several years, it seems that, and again, that's a combination of a lot of factors, you know, that the response times, I think, have not met our goals of the county, of the health department. Is that correct? Of the county contract?
Correct. There is some compliance issues every month, yes.
And because of those compliance issues, I think there are some penalties that AMR is
Yes, sir.
having to pay on those.
Yes, sir.
And of course, my goal is being, you know, a physician that hears a lot of comments about response times and can't get anybody there and whatever. You know, I'm very sensitive to those comments. I'm also sensitive to comments to our AMR units that can't get a patient unloaded because there are no beds in the hospital, because there's nobody to staff our hospitals upstairs, so we can't get the patients out of the ER so we can unload a patient. You know, I mean, it's a multifactorial issue. And part of that is the issue of the increase in revenue, hopefully, you know, from the rates, which I think we all recognize need to be increased, would be helping to get, in some way, AMR outside of those, or making those goals so they're not penalized. And that is being able to recruit and retain your staff, you know, and keep everybody on the road. So do you have any thoughts about the goals and the standards and kind of the future and what this might mean toward being able to keep our EMS systems in play and being able to staff and meet the goals that the county set? Or
I think the biggest challenge that any EMS provider is probably facing right now is staffing, and that's probably the biggest issue that everybody's facing, along with a lot of other disciplines across our workforce as far as staffing. I believe that's AMR's biggest issue right now is staffing. I really don't think that they're not wanting to staff trucks. I don't think they're not wanting to put trucks on the road, but they do have that issue. And so hopefully increasing these rates will help, you know, fill in that gap, maybe allow them to put more staff on. But I really think that's their biggest problem. I think that's getting better. To be totally honest with you, we watch those numbers every day, and that staffing is actually getting better, whether Mr. Spencer knows it or not, but it is actually getting somewhat better. Is it where we want it? No, but is it getting better? Yes, I believe it is.
And a question to you, Josh, do you likewise feel that, you know, that some of the issue in terms of response times and all are related to the revenue, and the increased revenue will hopefully help that, or decrease the times that y'all have issues with that?
Yeah, certainly. I mean, to Mr. Hamby's point, we're doing everything possible to increase our staffing, and this just helps us afford it a little bit better. But you know, there's many other things aside from just staffing that we've attempted to try to help kind of stop the bleeding, if you will.
That's a good point. I hadn't thought about that.
Whether that's our Earn While You Learn program, we pay people to go to school, whether that's the discharge lounges that we staff at the hospitals, try to help with that throughput, nurse navigation, we're trying to kind of get some calls rerouted to a more appropriate level of care than just an ambulance. All of that we've already done kind of at our expense, trying to help solve the problem. Additionally, we put surge units in hospitals from time to time for multiple hours a day to basically kind of, if there's five patients there, one truck can watch 5 patients, the other 4 trucks can get back on the road. So I guess the point is we're doing everything we can possibly think of, and I would also add that we certainly support the county's initiative to release an RFP to potentially while that could be bad for us, it's also the right thing for this community, because any provider, whether it's us or anyone, this contract is just quite antiquated compared to where EMS and healthcare is really in our country, especially in Knox County.
I have a follow-up for Mr. Spencer. If these proposed amounts were to go through, do you see changing what you've already implemented in your organization, or do you see that you would kind of go back to where things were, like you mentioned about kind of what you're doing to reorganize kind of the structure and doing school type related things, education related things?
No, ma'am. Those things have been in place and will continue to be in place. And if we can think of more ways to recruit and entertain our workforce, we'll certainly be doing that as well. There certainly is no intent to Mr. Hamby's point, to not try to staff more ambulances. We understand the community is growing at an extremely rapid rate, and it's requiring us to continue to staff as much ambulances as possible to kind of help solve that problem. But I think the proposed rates, in addition to the increase in revenue, again, will help us continue what we've done and hopefully advance more of what we've done as well.
Thank you. So I have a question too, Mr. Spencer. Okay. Will the increased revenue that you would in fact obtain if this rate increase is approved, would it just go to salaries? Would it be split up? Like, is it going all into one pot? How would it be?
Yeah, but that's hard to say at this point. I mean, I can tell you that it all goes certainly into the business unit. And like I mentioned earlier, this proposal wouldn't even get us to the black if it's $1 million. That our current deficit is quite substantial right now. But then again, I think that's largely because of the things that we've done trying to help the system, and I think that's why it's so important that the RFP be released and bring in other options to look at a more appropriate healthcare delivery model in EMS.
Okay, because I agree with Ms. Livers that it is important. I feel like if we did in fact approve a rate increase, that you continue to do the things that you have implemented in order to save money, and not come back in a year or two asking for another rate increase. And so I just wanted to know if you had any idea where this money would be going, if it's strictly to debt service to get you up into the black, or how it would be divided. But I understand that it would probably be stretched pretty thin.
And I'll say that we did a off-cycle wage adjustment just last year for our employees, which cost us even more than what this expectation is going to bring us in, just to try to continue to keep up with the demand for the workforce. I think the overall average increase of wages, December of 22 was it 22? Yeah, 22 was a little over $1 million into our expenses with obviously no offset in revenue. I think the average increase is about 19% for all of our employees, trying to help recruit and retain, to keep the ambulances on the road.
Thank you.
So for the health department there, get us all on the right power curve here as well, that the new RFP would be scheduled to come out when Mr. Hamby was it? I mean, it's not very, we're looking at sometime early in the next year, is that correct, or?
Well, no, the RFP, we're hoping to put the RFP out within the next month or two.
And a new provider would be selected to take?
Probably selected, what? September.
To take effect somewhere around the first year?
January 2024, yes.
January
That's the
2024.
goal. Excuse me, February 1st.
Yeah.
And the RFP is a certain thing, or is it, is it as a mandatory thing? Has to be done, correct?
Yes, sir.
That's all comments that I have.
All right. Any other comments, board members? And Melinda, if you would just let the record reflect that we did have a public comment period with no one speaking, so. All right.
So
Board
am I able to make
communication. We are down to the
Motion.
item of action.
I want to action. So, I would like to make a motion that we approve the rates as suggested by AMR.
So there's a motion on the floor from Dr. Dabbs that this committee approve the proposed rates from AMR,
I would like to second that motion.
seconded by Ms. Any further discussion on the motion? Seeing or hearing none, I'm going to do a roll call vote, just since we're making a final decision here. Ms. Livers? If you're in
Agreed.
favor of the motion, say aye.
Aye.
Ms. Chairwoman Durrett?
Aye.
Dr. Dabbs?
Aye.
And the chair votes aye. Motion carries unanimously. Is there any other business that needs to come before the committee?
I just want to appreciate the responsiveness of getting this to us. So I think it was well done.
I certainly concur there with that as well, and I think everything that was done here was done very positive, and I think we did our due diligence to look out for the citizens of Knox County, but also for the EMS provider for Knox County as well. So, Mr. Van de Beek, you got something for us?
Mr. Chair, just on behalf of the mayor, I want to thank the committee for their service
Thank you, sir.
and mention that the Public Building Authority is going to upgrade the AV system so that you quit getting that squall in case you're called upon to serve again.
All right, committee members, is there any other business that needs to come before the committee? Is there a motion that we adjourn?
So moved, seconded?
We have a motion and a second to adjourn. And so, as I typically say, all in favor, rise to your feet. We're adjourned.
Thank you very much.